Hi, welcome to another episode of Atkins Diet Misconceptions. My name is, of course, Kent Holton, and today's episode is going to be probably one of the longer episodes I've ever done. I may decide to break it up into two sections, but at this point, we're going to plow right through it, and because I think the information that's included is going to be so important that we need to get it out there and make sure that people understand it. Today's episode has to do with diabetes and the low carb or Atkins diet response to diabetes, whether it's a good thing or a bad thing. First of all, let's take a step back. One of the key indicators for whether or not you're diabetic is the HbA1c diagnostic marker. And that typically, if it's above 6.0 in the United States, that indicates that you're a diabetic. Above 6.0 should be, those people should be monitoring their blood glucose on a daily basis. There's really two types. Apologize if this is rehash for anybody, but there's a type 1 whose body simply does not make insulin at all. Those people are typically known from early on in childhood. And then there's also the type 2, usually the adult onset diabetes, or there's also coming more and more the juvenile onset diabetes. And that's typically more of a response to one's diet, past diet, and the body becoming desensitized to the glucose within the body and not producing enough insulin to take care of it. Let's go with the first of critics. And the reason this video even is being made is because one of the critics came by my Atkins Diet story video yesterday and posted that you're more liable to be a diabetic if you're a low carb follower. What? So I went out and started looking at the critics site, and of course you have the Diet Atkins Exposed, the PCRM website, who goes, Nancy Damon, registered dietitian at Geauga Falls General Hospital, said her main concern with mixing low-carb diets and diabetes is the likelihood of dangerously low blood sugar levels during the first 2 weeks of the diet. People with diabetes who allow their blood sugars to drop to severely low levels may pass out, develop tremors, or go into a diabetic coma, Dam said. And she follows up with a very high protein diet, which I've disputed more and more with this diet, that it's not a high protein diet but a high fat diet, but these people don't seem to grasp the clue, is especially risky for patients with diabetes because it can speed the progression of diabetic kidney disease. And there's also another link out there, diabetessuffolk.com, and there's two types of diabetes. People who have type 1 diabetes produce no insulin themselves, like I've said. They depend upon regular injections to provide their bodies with insulin. A low carbohydrate diet would influence the amount of insulin required to make control of blood sugar levels more difficult. Just as an aside, how would controlling your blood glucose levels to a more regimented level make controlling them more difficult? It might, one, make it more regimented as opposed to today for dinner I had a donut, yesterday for dinner I had a chicken salad sandwich. My blood glucose is going to be more difficult to control if I'm varying the amount of carbohydrates I'm eating in my diet than not. But back to the story. So there's definitely a large proponents of people out there who are against it. Although up until 1960s, the common diet for controlling diabetes was a low carb diet. In the diet 70s and beyond, or 1970s and beyond, the ADA start recommending a high carbohydrate diet and controlling it via insulin. Well, there's two main proponents of the low carbohydrate as being a mitigating or control factor for diabetes. The first one is Richard Bernstein. He was diagnosed himself as being a type 1 diabetic back in 1946. His original diet was trying to control it via insulin, but when he reached his 20s and 30s, his quality of life was severely degrading. He was seeing a lot of the diabetic side effects in that most common diabetics see, the cardiovascular disease, the breaking down of organs, and those sorts of things. And it was at that point that he started developing, well, the what if. How else should I be controlling my diabetics? And he's actually the author of the Diabetes Diet and the Diabetes Solution, two notable books on this topic. The second person is Mary Ross Vernon. She is the chairman of the board of the American Society of Bariatric Physicians and also worked with Dr. Atkins in co-authoring the Atkins Diabetes Revolution book. And I'll put a link in the video description on a preview copy of that document. She was also recognized within 2007 and 2008 as the runner-up for the Diabetic Educator of the Year award. And here was her response. In my experience, all patients with blood glucose problems, whether it be a type 1 or type 2, benefits from the controlling of carbohydrates levels. Many type 2 diabetics no longer need medications to control their blood sugars when their blood sugar measurements become normal when they follow this dietary plan. Type 1 diabetics, by avoiding the ups and the downs in their blood sugar readings, can also benefit. If a type 1 diabetic takes enough insulin to keep their blood glucose normal when it was high based upon what they ate, then as their blood sugar drops too low, if they do not eat that way all the time. If they do eat in such a way as to have elevated blood sugars all the time, the amount of insulin to control their blood sugar numbers in conjunction with the excess carbs causes weight gain. So it is almost functionally impossible for the type 1 to avoid hypoglycemia and weight gain unless they control their carbs carefully. Many of my type 1s do very well on 2 injections a day. They use no more than the amount of insulin equal to the amount your body would normally secrete to keep glycogen in check. The basal amount is about 1 unit per hour, and my patients with insulin pumps do very well too. The real trick to all this is having the advice and guidance of a physician knowledgeable with the various insulin preparations and the effect of carb control to guide you through the transition from the ADA roller coaster to the smooth sailing of carb control. Most physicians have never experienced the need to decrease medication, so they are tentative to talk about tapering insulins, antihypertensives, and diuretics rapidly. When carb control is initiated, the need for blood glucose and the blood pressure lowering decrease rapidly. Some type 2 go from needing 100 units of insulin per day to needing no insulin per day in less than 3 days. That's pretty powerful stuff. But that's 2 notable proponents of what carb control or restricting your carbohydrates can do. What do the studies show? Well, there's been a number of major studies recently published. One was published in Nutrition and Metabolism magazine in 2005. The case for low carbohydrates diets and diabetes management. And in this document, more than any other, I've seen how they describe the effects of a high carb diet on someone with diabetes. Let me read. Compliance with these lifestyle modifications is less than satisfactory, that is a high carbohydrate diet. And a high carbohydrate diet raises postprandial plasma glucose and insulin secretion, thereby increasing the risk for cardiovascular disease, hypertension, dyslipidemia, obesity, and diabetes. Moreover, the current epidemic of diabetes and obesity has been, over the past 3 decades, accompanied by a significant decrease in fat consumption and an increase in carbohydrate consumption. So it's basically pointing back that the high carbohydrate diet has not been one that has lowered the diabetes, it's increased the diabetes, as well as once you're a diabetic, it's increased the severity of the response. Let me continue. High carb. These metabolic abnormalities are more pronounced in the diabetic population, leading to a worsening of glycemic control, dyslipidemia, and increase of inflammation, to name a few. I.e., more and more people are seeing the worsening effects. The inflammation that she talks about is what is causing the amputations amongst all our diabetics. These cells are becoming overly saturated with glucose, which ends up killing the cells and causing gangrene, which is causing the need for the amputations. Let me follow on. These data show low carbohydrates diet to be comparable or better than the traditional low-fat, high-carbohydrate diets for both weight reduction, improvements to dyslipidemia of diabetes and metabolic syndrome, as well as control of blood pressure, postprandial glycemia, and insulin secretion. Furthermore, the ability of the low-carbohydrate diets to reduce triglycerides and to increase HDL is also of importance, which is the benefits or the lessening of the possibility of the cardiovascular disease. Compelling evidence from clinical and metabolic studies demonstrate the worsening of glycemic control and dyslipidemia in diabetics with high carbohydrate diets, whereas the low carbohydrate diets may reverse these serious metabolic abnormalities. And finally, they go on to say the low carbohydrate diet compares more favorably, at least over the short term, in traditional low fat diets for improving glycemic control, insulin sensitivity, dyslipidemia of diabetes, and so that study more showed the failure of the existing system, the failure of trying to control diabetics by jacking up their patients' carbohydrate levels to high levels consistently throughout the day, and then controlling that with constant and frequent insulin injections.